Dear friends, dream of every medical student is to study in most premier institutes like AIMS, PGI, JIPMER, NIMHANS, and others. All the medical students invariably attempt and try for getting into these institutes. There is a separate entrance exam called INICET for these premier institutes. And just imagine all the students are aspiring for that, and you become the topper of that examination. How nice it would be, how nice you feel, and how much of not just the nice thing, how much of hard effort, hard work is required, how much of dedication, commitment, how to manage your mental strength, so many things, right? Yes, let's listen all this from the topper herself. We have with us INICET 2021 topper, Dr. Sai Sangeetha P from Bangalore Medical College. Welcome to you, Dr. Sai Sangeetha, and hearty congratulations on behalf of all the members of the White Army.
Thank you, sir. Thank you so much.
So, since when you exactly started your preparation for PG entrance examination, and how did you prepare about 3 months before the exam, 1 week before the exam, and on the previous day of the examination?
3 months before, I would start like each month my strategy was different. During the first month, in those 3 months, I would do conceptual subjects. Like I did physio, patho, pharmac with medicine. Because if we have covered physio, patho, pharmac, medicine is just a combination of all three, and medicine takes less time.
Yeah.
So I had covered those 4 subjects in the first month, in those 3 months. And during the second month, I've done subjects like half of them which were factual, half conceptual subjects like anat, surgery, pharmac, and micro. And during my third month, I've done minors, because minors are usually like, we don't go in depth into it, and it is a bit memory based. So OBG with minors I had done in my third month. And 1 week before the exam, I had just done my pre-para. If it's NEET, again it changes. If it's NEET, it's better you guys do clinical subjects more, because NEET is mostly third year and final year subjects questions. Pre-para is not that much asked in a recent next or a NEET pattern what is coming. They're concentrating on third year, fourth year. But if it's INICET, it's pre-para what they concentrate more than surgery or medicine. They ask easier questions in surgery and OBG in INICET. But if you guys are preparing for NEET, I think you guys should add on the revision of surgery and medicine during the last 1 week. Like it becomes a must. But if we are writing INICET, pre-para is a must. So in 1 day before, it's just the previous year papers. And if you've prepared any important topic list, or for a subject, I would write like 2 to 3 pages for each subject, which I have to read like 1 day before exam. I would just read that notes with previous year papers. That's it.
Sai, what do you feel the best part of your preparation?
Best part of my preparation was the notes I had written, the 2 to 3 pages of notes I had written. I think around 15 to 20 questions came from like 10 pages or whatever I've written. So I think that is what was special about my preparation.
And what do you think you should not have done during your preparation?
During my preparation, during my UG days, I didn't know surgery was difficult during PG entrance exam. So I wasted too much time on surgery during my preparation. Like if I knew this surgery had so many stages and so much of treatment, I would have read during my UG days. I didn't know that. So I think surgery is one subject which everyone should cover at least 50% during their UG days. Because I took a lot of time, like I wasted almost 2.5 months for surgery. I think that was one of my drawbacks in whatever I prepared. And previous year questions, I think they should see it from their first revision. They shouldn't keep it to the last revision. That was the second mistake I think I had done during my preparation.
Can you please more stress more on this need for revision and also solving previous year question papers?
Previous year revision, for me, every revision I do, it contains 2 revisions. Meaning to say, every day morning I start with a revision. So if I'm doing one reading, it means it has two revisions. Like one thing I'm reading now, and every day morning one revision.
Revise.
So I would, so for me, one reading is like two revisions in it. So if I'm doing 3 readings, it's like I've done 6 revisions indirectly. So I think that early morning 1 hour of revision of the previous subject I've read was something which is different, and it will help you retain longer because we're doing it early morning.
Okay. What about the solving previous year question papers?
Does it help? It is very helpful, sir. If it's NEET, previous year papers, they just repeat the topics. Previous year questions come like 1 or 2 questions. But if it's INICET, previous year questions come around 50 questions. So I think it depends on the exam we are writing. For NEET, it's the topics which are important. For INICET, they actually repeat the same questions with minute twists in it, like they add a not or an except to it, or they slightly change the words in the options. So we have to be careful, but they do repeat the questions.
You did your internship from Bengaluru, that's Victoria Hospital, Bowring and Minto, very hectic. How did you manage to study during your internship?
Internship, I didn't actually read, sir. Like I did my internship properly, and then post internship, I started reading.
So, how many hours you dedicated for studies post internship? How you used to study? Please, your timetable.
Early morning, 6 o'clock, I would start my day. 6 to 7 would be my revision. 7 to 9, I would do a session. 9 to 9:30, I would take a breakfast break. From 9:30 to 12:30 is my second session. 15 minutes of break, and I would sit back till 2 o'clock. And then 2 to 5, then I would take a break for half an hour or something. Then I would solve MCQs, and then I would end my day. But every day, I used to solve different set of MCQs. I used to not repeat the MCQs. And last 1 hour of the day, I would always solve previous year questions. And in previous year questions, whichever questions were difficult, I would write it down. And next day, early morning, I would see the difficult previous year questions and I would do the revision. So previous year questions are very important, that if the question is difficult, we need to learn it. Like we need to understand the question.
Really focus while solving previous year questions, whether how to solve the questions, or you were really interested in knowing your assessment, like assess yourself with the marks, or you want to know the concepts behind that? What you really focus while solving the previous year questions?
Previous year question papers, for the first time, I think all of us should solve a paper like a real exam paper. From the second time, it's the topic which is more important than the question itself, because in some of the previous year books what we are getting, few answers are wrong. It's necessary that when we look at the concept behind it, we understand what is wrong and what is right. And in exams, what they're asking are these controversial questions, like exactly the professors know where to ask a previous year questions because they're controversial. They know it that they have to ask this, so that how much effort a student has put in, they actually check that. So yeah, like if you have a doubt in a previous year question, I think it's worth it that we go waste some 5 to 10 minutes of time and check for the correct answer. Like if you're just mugging up the answer there, I think it's really useless, because in the exam we are losing an easy question which is like absolutely not good.
Sangeetha, you had read all standard books during your MBBS days?
No, sir. Like a few important topics I had read, but not all of them.
You used to refer them, okay? You used to refer the standard books.
Standard textbooks for few important.
Okay.
Yeah.
You are content with the Indian authors and you are studying them.
Sir. Yes, sir.
And yeah, you during MBBS days also, I know. Well, you are like not a topper or so. You are just like average student who are doing well, right?
Yes, sir.
So it motivates a student like me who are mediocre and not so good in studying, not so intelligent, that even I can do. Yes, I can do. If with hard work, some dedication, if I put on, even I can achieve like SAI Sangeetha has done. No, like during your preparation time, you must be having terrible stress levels and tensions and all.
Yes, sir.
How you used to really manage these, and what is your relaxation technique?
I think every day before I sleep, I would tell myself what my plan of the day for the next day. Like I would make a plan as to what I'm reading the next day. And whatever happens, I would not change the plan, because once we change the plan, we tend to stop all the topics in the day in the middle. So at the end of the day, we wouldn't have covered any topic perfectly. I think that's the first thing which actually helps me, that planning at the night, and just before going to bed, I think you can lie on the bed and just revise the plan of the day once in your head just before going to sleep. And whatever we do just before closing our eyes, it just stays in our head, and we get up with that motivation to read the next day. And early morning, before I start my day, I do yoga. So that is one more thing which keeps me motivated to read. And in the evening, most of us are tired, so I used to meditate for like 10 minutes every day, so that for the night session before I start my MCQs, I'm fresh again. And meditation actually helps a lot, because I've done it during my last 1 month. It is real stress buster. Like, it's worth those 10.
Don't think like, oh, I'm wasting my time if all my friends will be studying, but I'll be what I'm doing here. Such thoughts won't come to you?
I think the first week we meditate, such thoughts do come. Then when the fruits of meditation start paying us off, I think we get into that stream of meditation.
Wait for the effect, results.
Yes,
then you'll realize the value of it.
It's just that first week we have to concentrate.
Yeah. So how was your preparedness levels, and what you really faced on the day of examination?
I think I was actually very scared when I came out of my INICET. My computer was like not working for 15 minutes during the exam.
Goodness. Then we got first rank.
Like, I wrote my exam for the first 15 minutes, and then computer broke down. And then by the time they got the new computer, fixed it, like it took around 15 minutes in the examination hall, and my stress levels were peak. They were in peak. And then my first 50 questions, I told myself, because I think I had a habit of meditating and all that, I knew how to calm myself down. And then I calmed myself down. The first 50 questions, I knew like I would tend to mess up. So I just did the questions which I knew they were too easy. Like, I just did the repeat questions which came. I left all the new questions. So by the end I solved those 50 questions. I knew like my stress levels came down. I could adjust my time because I had done just the previous question. So from there, I went to the last 50 questions of my paper, so that I have a change of mind and change of subjects to calm myself down. And then the last 50 questions I did again slightly at the slower pace. I didn't do too many difficult questions. Then the last 100 questions I solved it at a good pace, because I've already finished half of the paper and I knew I could adjust my time. So I think my stress levels came down. Then again, I went back to my first 50 questions, which I had left like most of them because I was stressed at the beginning. And then, that's how in the exam I managed my stress. And then
so you have to categorize the difficult levels, and you have to solve the easy ones first, then the medium levels, and finally the difficult ones, so that you can manage your time as well as the stress levels, and you can complete. You will go through the entire question paper thrice, maybe. Maybe some question you will answer for the other thing, so you get to see the overall picture of the question paper, and so many things will help. So what was your score finally?
Around 170, sir.
See, do you believe in destiny, Sangeetha?
I do, sir.
Because now everyone have to believe, because your example, losing 15 precious minutes, okay, leave about the time. What is the mental condition during that time? Okay, you are appearing for such a important exam, and you have put in all such hard work throughout the year, and suddenly you are because of some technical glitch, you have to suffer. Even then you manage to become a topper. Then every one of us have to believe in this so-called destiny. Okay, that shows, okay, if you deserve something, you will definitely get it. Okay, so your hard work or your patience, everything paid well for you. So now, you're the topper now. Okay. So what's your future plans? Like, what branch you want to take, and where exactly, and why?
I want to take up radiology, sir, in AIIMS Delhi. AIIMS Delhi.
Why radiology?
Why radiology? Like,
just because every topper takes that?
No, sir. Like,
just following the trend.
Like, during my internship, I attended radiology for around 2 weeks inside BMC, and I was somehow attracted to radiology, like the work style and all of that. I think I liked inside BMC the department of radiology.
More than that, what I feel is seeing the trends. See, toppers means they'll have a lot of knowledge and they're so intelligent. And for radiology, you should know everything about all the subjects. You should know gynecology more than a gynecologist. You should know surgery more than a surgeon. Nowadays, it has so happened that all the diagnosis, everything made based on the reports by the radiologist. So you can't attend to miss
variety
anything.
Is nice, sir. Like every we keep changing our mind. We keep thinking about new diagnosis. I think it's interesting.
And best reassuring part is the interventional radiology. Nowadays, your right hand, okay, right hand is maybe left hand is the USG or this thing, but the right hand is the interventional radiology. In our cardiac surgery only, most of the aortic dissections, type B dissections, everything managed by the radiology, interventional radiologist by doing stenting and everything. So it has become
cardio is one of my special interests. Like I think from first year, I think I have an inclination towards cardio. Like
okay. No, that's the future. That's the future. Will in the future this interventional cardiology will come up like in a very big way. So
yes,
if you're really prepared for that, you can be the best in that. So you have all the potential to become the best. So what do you like to say your juniors? What do you like about their preparation and the hard work levels and what's really required to achieve whatever we wish?
I think firstly, they should dream something depending on their capability. The dream can differ from person to person. It need not be really big like AIIMS Delhi. It can vary from person to person. But whatever the dreams were, they should be determined to achieve their dream. Like unless there's no determination for your dreams, I don't think it's possible. Firstly, determination is very important. You should be so determined that every day, as soon as the alarm rings, you should be able to get up. And then first thing is we should push ourselves for almost 1 year to get up from that bed early morning. And unless you're so determined to achieve your dream, I don't think it's that easy for us to every day get up and push ourselves and sit back. We know like everyone at the home will be sleeping. We'll be the only people getting up, doing all of it. Like we'll be reading continuously in the same room. I think firstly, unless we have the dream, we have that vision where we want ourselves 10 years down the lane. Unless that vision is there, that dream is there, that determination won't come. And that determination should be persistent. Unless that determination is not persistent, I don't think we'll get our results. Like even a single day loss is a loss. Like there's so many people will go up ahead of us, even if it's a single day which we've lost. But if that single day we've lost is because of a real reason, I think God excuses us for it. Like if your parents are ill and you've went out to help them, I don't think that is wrong. But if you're just wasting a day like just like that, like just because you're too tired or just because you have your own personal reasons, I think that is not something acceptable. You can take like 2 to 3 hours of break if you're too tired and get back to studies, but you can't waste more than 5 hours in a day. Like we have to be persistent, we have to be consistent every day. Every single minute matters. Like every single MCQ here and there, it matters. Even an internship, I think I would really tortured my PGs to teach me every single second. Like they would be like, please leave us now, enough, please we'll read and come and teach you. But still my PGs were so patient to teach me. I think I should be really thankful to all my PGs. Like there was this question in orthopedics.
Now they'll be the most happiest ones.
Yeah, I know. So they were like,
now they'll be taking the credits. Yes, I taught her.
I taught like in ortho, there were so many clinical questions. Like we were putting up splints and all that, and there was a question. And I actually tortured my PG. I'm like, sir, tell me the paths. I'm like, sir, I'll put this and all that. And then I texted my PG. Actually, I'm like, sir, we put this, so I got this question right. And he was so happy. My PG was so happy about it. So yeah, like every single effort we put in somewhere, and if we are so dedicated, I think God gives it back. It could be a question or it could be anything else. It will come back to you. And some people put in so much effort, they'll not getting back. But sometime in life, I feel it will pay back. Like if someone feels, okay, my efforts are not paid back, I don't think they should be depressed. It will come back to them someday or the other. But consistency is very important. Like every single
Consistency
day,
is the key.
he is.
Okay. I also believe
Unless,
the same, Sangeeta. I feel that we become what we believe. That belief should be there. Like you said, no. First thing I should believe that. I always believed that. Even after finishing my MS, I always thought that I am the AIMSonian. I'm going to do cardiac surgery in AIMS only. Even before starting preparing for MCH entrance exam, or even even not even applied for the exam. Even before that, I used to search the room near AIMS where to stay and all. That was my belief levels or confidence levels. And yeah, when you believe firmly, all your actions, thoughts, everything will be accordingly. Okay, you'll put, like you said, if you want to have a big dream and if you want to achieve it, definitely automatically will wake up in the morning, because
exactly.
like that, everything will take its own course or action. First thing
Like
you need to
many
believe.
of my friends actually stopped reading after NEET. I think from the day one I started my preparation, I always wanted to do in a central institute. I mean, that motivation came from my brother actually. He is doing in JIPMER. And after I've seen the central institutes are something different. Like the teaching programs, or it's different from a
Protocol
normal
based,
institute.
everything is so
Everything is
systematic.
different. So I think it's a dream for me to do in a central institute. I never thought I would get rank 1, but I always wanted to do in a central institute. So actually, when I didn't get a seat in May INICET, I was very depressed. So I didn't read for NEET because that was not something which I had dreamt of. So immediately after NEET, I started my preparation again. I didn't want to give up, though I had given 2 attempts. So I think finally my efforts paid off. That's what I want to keep telling everyone. Like, put your efforts into it till you achieve your dream. Don't give up in the middle.
Very well said. Sangeeta, you might have solved thousands of MCQs.
Yes, sir.
Thousands of
Yes, sir.
MCQs.
Yeah.
Can you please tell us what's your way of solving them? Because yours must be one of the perfect ones. Okay, only then you could solve so maximum, right? So how do you, when you have some tough question and some confusing options, how do you deal with them?
If it's a multiple choice question, so like A, C, D type of questions, I would read all 4 or 5 statements. And especially in INICET, if I'm thinking of, there'll be one statement which in every MBBS graduate would know. So I would pick up that statement and I would decide whether it's true or false. And based on that, I would rule out 2 options. So if I ruled out 2 options, I would be left with 2 options. So I would just go to the options and I would read if they've given B, C, D correct or A, B, C correct. So I would read only the other 2 options, which I would not read all 4 options again. Wherever is the confusing option, only those sentences I would go read back and choose my option. But if it's a single best answer correct, it's obviously a 2 options we can easily rule out if we have read decently. So in between the 2 options, I would select the option which I know slightly better and familiar. So I would just recall my notes about the topic, just a flash of second. I would just think about what I've written in my notes. And after that, I would read the question again and select between those 2 options, which is better, like based on my notes, what I've written. And whenever I didn't think of my notes, what I've written, most of the times I had gone wrong with the option. Like, I think that flash of mind that you have to go back, think what you have written exactly in the notes is important to choose between the options. Otherwise, we tend to do a mistake. And I think in such questions, I could do around 60 to 70% right. So that was an edge on over others, according to me.